Attention on deck. After serving 22 years as a medical officer in the U.S. Navy, our next presenter has been practicing GU oncology at the Moores UCSD Cancer Center since 2002. His particular interest is in germ cell tumors. During this time, he has interacted with more than 750 patients with this disease. Please welcome Dr. Fred Millard.
Well, thank you for having me here, and it's a pleasure to see you all. Many of you come from a long ways away. Let me start by saying that I am not a mental health professional. I'm just a country oncologist with an interest in testicular cancer, but maybe I've encountered a few of these problems along the way, but let's have a conversation about this. It's certainly an important issue. So, just to start by saying that, there we go. When you're diagnosed with cancer, that's obviously often a life-changing event. Even if things are ultimately going to be okay, as they so often are in testicular cancer, it's stressful. It's going to take some work. It's going to change your day-to-day life. It's going to affect your quality of life. And this causes natural reactions. People feel overwhelmed, they feel stressed and anxious. And I think all of us have had some of these emotions one time or another, whether it was around cancer or other causes. But of course, there also can be positive emotions that relate to having cancer. Might seem contradictory, but I think most of us bring hope to any new issue. We might even feel gratitude, both for the caring that we experience from people around us, and possibly because sometimes an event like having cancer can induce a change in the way we approach life or look at things that results in an even better situation after it's all over. And it's important, I think, to own up to the fact that with maybe the possible exception of Dr. Bagrodia, most of us don't have perfect mental health. And we bring issues to the table before the diagnosis is even made. Those are then going to color and affect how we deal with stressful situations like cancer. And they're going to still be there when we're done with that. And so perfection is not a reasonable goal in mental health. This diagram just sort of illustrates that there are all these different aspects to this issue. This is particularly related to what we in oncology call the AYA population. Maybe some of you have heard that phrase. It stands for adolescents and young adults, which of course is the population that primarily gets this disease. Some of you are still in that group. Many of us were in it once and now are no longer, but we can perhaps remember that there are specific emotional colors that come along with being in that age group, with stressful issues that relate specifically to that. Many of these patients may not have yet established families. They may not yet be economically stable. They have goals and aspirations for careers which may suddenly seem not as achievable. So the AYA population is what this disease is really all about. So I want to tell you a brief story. And this is a real patient of mine, although this picture is not a real picture, and his name is not Danny, but I'll call him Danny. I met Danny about 3 years ago. He's 28. He was married. He had 2 small children. He presented with a lesion in his testicle and had an orchiectomy. It showed embryonal cancer. The rest of his staging showed his HCG was abnormal and was rising. He had some retroperitoneal nodes that were not too big. So I told him, we need to treat you, but this is going to be okay. This is what we would call good risk clinical stage 2 disease, and there's an extremely good chance that we can take care of this and things will be fine. But Danny wasn't really having it. And he said, I don't think I'm ready for chemotherapy right now, Doc, and let me think about it, and we'll get together next month and we'll see. And sometimes when you hear that, what they're really telling you is, we're not going to get together next month and I'm out of here. But in Danny's case, that wasn't true. And he kept coming back whenever we asked him to. He kept getting his labs done. He kept getting some CT scans done. But he never would consent to undergoing treatment. This is a graph of his HCG between July of 2020 and November of 2021. And you can see that after quite a period where, interestingly, without any treatment, it actually declined a bit and was fairly stable for a long time, but eventually the disease really took off and it's manifested in the HCG. I will also say, interestingly, that I don't have pictures, but his CT scans actually got better, objectively got better during a period of time when he was taking no treatment. But then they got worse. So in January of 2022, he started to have more symptoms. He started to lose weight, got hard to breathe. I told him, even now, we can probably fix this. You just got to come in, we'll get you going on chemotherapy. He said, even though he couldn't breathe, I feel better. I think things are starting to improve. He was admitted to the hospital. He went into respiratory failure, and he died. That's hard to take. This was a young man of 2 small children with a disease that we know how to cure, and he died. So how do we understand that mentality or that psychology? Clearly, we failed him. I failed him in some way. But how do we understand this? And I don't have an answer other than to say that this is one of the challenges for treating this disease, or probably any disease, is to understand not just the science and the biology, but the psychological underpinnings and the humanity of this. So what can we tell patients, how to get at this? And some of these might seem like sort of homilies, and maybe they are, but they also contain a little bit of truth. You need to educate yourself as much as you can. You need to advocate for yourself. You need to ask questions. You need to foster and take advantage of the relationships that you have. You need to not just become just your diagnosis, but keep doing things that bring you joy and pleasure and enhance your curiosity. There are assets. This meeting and this group is one of them, of people you can reach out to look for advocates and for information. Physical exercise, I think, is extremely important. It certainly is for me. I go to the YMCA almost every day, and it can keep you going when other things can't. Some people say that writing things down in a journal can be very helpful. Acknowledge how you feel. To the extent that you try to be tough, present only some controlled exterior to the world, those emotions aren't going away, and they're going to cause you trouble if you don't let them out. If you have the ability to meet with a mental health expert, that can be very helpful. That can be challenging to find and undertake sometimes. And there's a variety of other things, and not last but not least is what are your faith or belief systems? Do you have a community in a church or other organization of people who can help support you? So just to say that before, during, and after treatment for this disease, we bring issues with us, we acquire new stresses during treatment, and then we deal with the aftermath. And this can have all kinds of a long tail on this whole treatment: fear of recurrence, impact on our romantic relationships, financial stress, how it affects our jobs, etc. So I will just, in finishing up, say that there is a lot of interesting science going on in the effects of testicular cancer and its treatment on cognitive and neurological function. Here's an example of that. This is pretty much, I don't think, translated to the clinic too much yet, but I hope that that will happen eventually. And this is a paper that Dr. Bagrodia wrote, which I will use to point out that the psychological issues around this disease, or any disease, are on both sides of the desk. So the physicians have stresses. It's hard to take care of people with serious illnesses who sometimes don't do okay. And if we want to have a healthy healthcare system, we need healthy physicians and other healthcare providers. And to pretend that doctors do not experience stress or healthcare or mental health issues, is just not accurate. We have to take care of ourselves too. And I'm going to finish by saying that we're all in this together, but part of being in this area is that recognizing that our systems are imperfect. And I think it's fair to say that the mental health system in this country is maybe even a little more imperfect than some other systems, and in terms of understaffing, issues with access, and the total number of people who could potentially benefit from these services is currently much larger than we have the assets to meet. So I'm going to end with this. This is my generation. Maybe some of you will recognize that photograph as being in Bethel, New York in 1969, what was called the Woodstock Festival, even though it wasn't in Woodstock, New York. And here's a statement made at that. So it's up to us. Look around. These people are your brothers and sisters. Treat every person here like they really are your brothers and sisters. Share, take care of each other, and that's the way we'll get through this. Thank you.